PR is a 71-year-old white female. She is English speaking. Patient is unaccompanied and can answer questions appropriately. PR is established with the clinic and has Medicare. Subjective. My throat and mouth have been on fire for 3 days. Patient comes into the clinic today with complaints of a burning pain to her mouth and throat for the last 3 days. Rates pain 8 out of 10. Denies any injury to the oral mucosa or throat prior to the notice of symptoms. Admits difficulty drinking liquids and eating food due to the pain. Reports a bitter taste in her mouth as well. Patient reports that she has only been taking Tylenol to ease the pain but receives minimal relief. She also reports that she visited an urgent care 2 weeks ago and was treated for acute bronchitis with antibiotics and an inhaler. Patient is unable to recall the names of these medications. Patient has a history of type 2 diabetes since 2013, bipolar disorder in 2005, hypertension since 2013, sleep apnea, hyperlipidemia, hyponatremia, history of alcohol abuse, back pain, and cervical cancer. She's had a left total knee replacement in 7 of 2020 and a cholecystectomy in 2018, and she had a hospital stay at Oceans Behavioral in April of 2023. She's had a mammogram at Cabrini on June the 30th of 23 that was negative, a pap smear 3 years ago that was negative, a bone density scan 12/22 of 21, colonoscopy times 2 years ago that was negative, never received pneumococcal vaccine or shingles vaccine. No known drug or food allergies. Medications. Abilify 10 mg tab, 1 tab PO once daily. Lamictal 100 mg tab, 1 tab once daily. Lithium carbonate extended release 300 mg tab, 1 tab PO twice daily. Rosuvastatin calcium 5 mg tab, 1 tab PO once daily. Clonidine hydrochloride 0.1 mg tab, 1 tab PO PRN for a blood pressure of over 180 or 90. Clonidine methocarbamol 750 mg tab, 1 to 2 tabs by mouth Q8 hours. Celecoxib 200 mg cap, 1 cap PO with food once daily. Losartan potassium 50 mg tab, 1 tab PO once daily. Amlodipine mesylate 5 mg tab, 1 tab PO once daily. Furosemide 20 mg tab, 1 to 2 tabs PO once daily. Austedo 6 mg tab, 1 tab PO twice daily. Solifenacin succinate 10 mg tab, 1 tab PO once daily. Seroquel fumarate 100 mg tab, 1 tab PO at bedtime. Ozempic 0.5 mg injection sub-Q once weekly. Xanax 0.5 mg tab, 1 tab PO twice daily. Trintellix 10 mg tab, 1 tab PO once daily. Zofran 4 mg ODT, 1 tab on tug and allowed to dissolve PO once daily. Oxycodone acetaminophen 10 325 mg tab, 1 tab PO every 6 hours as needed for pain. Social history. Patient lives in a 2-bedroom house in a rural area. The house was her parents' home that she had remodeled. She reports few neighbors but is close with them and they can check on her frequently. Patient has no children and is single. Patient is a former smoker, quit 2 years ago. She admits to heavy alcohol use in her 30s and 40s but has been sober for over 15 years. Denies previous or current drug use. Patient seldomly attends church whenever her neighbors invite her. Patient is retired. She worked for the school board as a bus driver for 35 years. Patient utilizes a walker and performs chores and tasks around her house as much as she can tolerate. Her family history includes her father, who's deceased at 65, history of bladder cancer and CHF, mother deceased 72, CAD, type 2 diabetes, and a CVA. She has no siblings. Review of systems. General, denies chills, fever, fatigue, weight loss or gain. Eyes, denies blurred vision. ENT, denies decreased hearing, tinnitus, ear pain, ear problems, admits to a dry mouth. Denies dental pain problems, admits painful red bumps on tongue. Denies nasal discharge, frequent sneezing, congestion. Denies neck tenderness or swelling. Cardiovascular, denies chest pain, claudication, dizziness, dyspnea on exertion. Orthopnea, palpitations or shortness of breath. Respirations, denies asthma, cough, wheezing, or shortness of breath. Gastro, denies abdominal pain, constipation, diarrhea, nausea and vomiting. Musculoskeletal, denies arthritis, joint pain. Neuro, denies headaches, dizziness, seizures, tingling, or numbness. Psychiatric, denies anxiety, depressed mood, or suicidal thoughts. Vital signs include blood pressure 116/66, heart rate 86, Respiratory rate 18, temperature 98.2, O2 is 95% on room air. Height is 68 inches, weight is 224 pounds with a BMI of 34.06. Physical assessment, general, no acute distress, dresses appropriately, well groomed. Head, hair is thin but evenly distributed, normocephalic. Eyes symmetric, perla, pupils equal 6 millimeters bilaterally, brisk by bilateral movement, conjunctiva pink, moist, no drainage noted. ENT, ears bilateral, symmetric, no swelling, redness, or visible drainage. Nares patent, no swelling or drainage noted. Tonsils present, no swelling. Mouth, small white plaques to the tongue, roof of mouth, and buccal mucosa. Redness noted. Plaques can be scraped off. Dentures are present. Neck, no JVD noted. No lumps, symmetric, non-palpable lymph nodes, non-tender. Cardiovascular, S1, S2 noted. Apical pulse strong, 3+. PMI, left sternal border, fifth intercostal space, midclavicular line. No murmurs, clicks, heaves, or lifts noted. Respiratory, clear lung sounds in all fields, no wheezing noted. GI, bowel sounds present in all quadrants, soft, round, non-distended, non-tender, non-palpable masses. Genitourinary, bladder non-distended. Reproductive, deferred. Neurological, all cranial nerves intact. Psychiatric, maintains eye contact, appropriate affect, answers questions appropriately, mood calm and happy. Lab and diagnostics, none indicated. Assessment, differential diagnosis. Candidal stomatitis, aka thrush, B37.0. Positive findings include white oral plaques on an erythematous base, and the patient is a diabetic or the presence of a chronic disease. She wears dentures, and she's had recent antibiotic use, and the plaques can be wiped off and leave a red, raw, bleeding base, and she has burning pain due to raw surface. I have no negative findings, and all of this came from Hollier's clinical guidelines and from Ferry's clinical advisor. Second differential is burn to mouth and pharynx, T28.0XXA. Positive findings include burning pain and a red raw surface with blisters. Negative findings are the white curd-like patches, and she denies injury to the mucosa, and this is from Ferry's clinical advisor. Differential number 3 is leukoplakia or smoker's keratosis, K13.2. Positive is white lesions. The difference is that in leukoplakia, the lesions cannot be scraped off, and hers can, and this came from Ferry's clinical advisor. So my diagnosis is candidal stomatitis or thrush, B37.0. Treatment is to prescribe nystatin oral suspension, 100,000 units per mil, 4 to 6 mils, 4 times daily. Swish 1/2 dose in each side of the mouth. Retain in mouth as long as possible before swallowing. Continue treatment for at least 48 hours after perioral symptoms disappear. From Hollier's Clinical Guidelines in Primary Care, 2021, page 215. Secondary intervention, direct clinical practice, evidence-based research. Provide instructions to the client on importance of maintaining good oral hygiene, removing her dentures every night and cleaning them, and maintaining adequate hydration. From Hollier Clinical Practice Guidelines in Primary Care, 2021, page 215, tertiary evidence-based research. Follow-up, symptoms should resolve in 2 weeks. She should return to the clinic if it worsens while on medication or if it hasn't resolved in 2 weeks. If the infection keeps recurring, then I would have to refer her to infectious disease. Level of billing is $99,214 office visit, established patient level 4.